I still have echo.
Yeah, I think now it's better. Thank you so much, and very sorry for the disturbance. Well, a warm welcome to all of you for another exciting episode on a podcast series with Enlightenment and Greatest. And I am honored to welcome Dr. Rao, who has over 50 years of experience as a medical oncologist in US in Virginia. And Doctor has specialized in internal medicine and hematology, and he has been got really great experience in treating cancer patients, breast cancer patients, and seeing various, various people with different health issues. So I warmly welcome Dr. Rao to this exciting episode of our today. And over to you, Doctor, for to hear from you. Thank you so much. Yes, Doctor, please go ahead. Thank you.
What is it? My turn to talk?
Yes, sir, please.
What do you want me to do? Introduce myself or what?
Yes, Doctor, please
Because
introduce yourself and over the topic. So we will love
oh,
to know
okay,
more about
okay,
your yes.
okay, okay. I got it. So all that I can say is, I don't have much experience in this podcast and Zoom meeting, even though I many times I participated as a participant. This is the first time I'm invited to talk something in public platform like this. But to say is that the basic topic is pain and suffering. We came up, Pooja and I, we came up with the subject of pain and suffering as a broad-based platform, which everybody has it. Every person, no exception, living and animals, everybody go through this, and there are so many progress and has been done in this field of pain and suffering, and therefore. Hope with a question answer session between Pooja asking me, and I will respond accordingly. So I'll stop it and put it over to Pooja.
Thank you so much, Doctor. So, Doctor, when we talk about pain and suffering, especially in a holistic life, we are seeing that nowadays small children who, whether there is no age for any kind of, health issues happening, like you talk about diabetes, stress, or diabetes, or
Mm.
high cholesterol, that's all, cardiovascular diseases, or let it be cancer. So, what do you think, why are we at this very early stage, we are, getting so many, diseases and health issues at a very early stage? What's the main reason behind it? Like, what would you think and how we can get out of this through a holistic way other than just running behind and taking pills of medicines every day?
No, we can never get out of all these things. They just come. The point is how we'll deal with that, handle it, and overcome it. And the pain is of two kinds. One is physical pain, other is mental pain. Lot of times, mental pains surpass the physical pain, and that will eventually enter a destruction of the person's life and a disruption of the well-being of the entire caretakers, particularly the people who love that and are fairly attached and and to that person who is having either both either medical pain or mental pain. With that in mind, in children, as you mentioned, children, they don't even if they have pain, they won't tell you because they are so innocent and young, and they cannot even express, they cannot communicate. That is little kids, and then they do their own business of self-destruct and things like that. And we should be very careful, the caregiver and the team, to give them appropriate intervention and supportive care, which is available. What means it is available locally as well also through the podcast like what you are doing right now. So the ball is on your side. Hello.
Yeah. So my question here is, what do you think are the common misconceptions people have about pain and suffering? Like, what do you
Okay.
think?
Now, I will come to this. Doesn't not necessarily related to cancer.
Mm-hmm.
Okay. Now let's only narrow down to physical pain, not a mental pain and suffering.
Mm-hmm.
Physical pain can come because of actually anatomy of the body. The pain is a one of the defensive mechanism to protect yourself, right?
Mm-hmm.
With that in mind, anything causing pain like a cut from a wound cut, infection, all those things can produce pain. And illnesses like diabetes produces inflammation of the nerve endings. Too much of drinking produces pain because the nerves get dull and you get hurt, things like that. So, lot of things. When such things happen, only the person would realize that, oh, I made a mistake, but what to do now? And when that situation, he will go and get a help. And that is allopathic type of approach. And there are so many other approaches parallel to the so-called modern medicine, allopathic medicines approach, and various type of pain suppressing and pain relieving modalities available today in this modern age and time. So that is for the physical pain. So when the pain comes, that is the priority for the person because it is felt 24 hours, 7 7 days a week. He or she cannot perform normally and go through that pain, and he will do or she will do whatever is to alleviate it. Okay, so that is physical pain. Go ahead.
Okay. So when we talk about stress, now most of us are really going through a lot of stress in our either in our work life or in our personal life, and then that triggers a headache, and that triggers a lot of pains internally, and somewhere down the line, as we were discussing, it is related to the physical pain. But then over the prolonged period of time, this physical pain gets converted, either we get high cholesterol levels, our blood levels are triggered, and so on. So where do you think, and also you mentioned about different, modern approaches for treatment, like allopathy is there, Ayurveda is there, homeopathy is there. So there are so many ways it can be treated. But it's said, once I start with these medicines, they are lifelong. Like you say, most of the women are getting nowadays hypothyroid. So that very early stage they have been detected by such illnesses. So what do you think? These pains can be controlled at a very, very earlier stage, or we have to wait for till it at most of us really ignore it. We just take Tylenol or something and we think, okay, it will get fine, but it doesn't after a period of time. Like migraine is one of them. So how do you think, how do you think should be our treatment options? When should we take the right step at the right time, according to you?
Mm. Majority of the people do not take right step at right time, and they don't even aware of their paining suffering, and they go to a bypass like alcohol, drugs, mood enhancing drugs, mood suppressing drugs, and then that will give them a temporary relief, and they ignore it up to the late stage. Then they realize, just to give an example, as a cancer specialist, I used to be referred to by patients who are a two-pack smoker for life. Then they develop cancer. Then they come to see me. It is too late, and then they have advanced cancer. And even then I ask the patient. He says, "I have been. How long do you have been smoking?" Do you know what he and she says? No, I stopped. No, I stopped smoking. When did you stop smoking? Last week. But he or she doesn't say 40 years of smoking produces cancer. But I laugh about them. But I am sympathetic because they are in advanced stage when they see me. But even then she will say, I will stop from now on. And then sometimes philosophically, I say, if you, by knowing everything, not right on the first visit, I tell them, if you enjoy it, you can do it. But certain treatments, this smoking, continuous smoking is not good. So I tell not to. Otherwise, you can enjoy. It doesn't matter. So you have to take it one at a time, situation at a time, just in that situation. And the anxiety is also a factor is there. For that, we can give a mild tranquilizers or a breathing therapy, something, the holistic thing. And there are other approaches until we establish the diagnosis of the cause. If you find the cause, then you can point to the handling the cause, not the symptomatic treatment.
Mhm.
Does it
Okay.
make any sense?
Yes. Anybody has any questions to add on to this, or anybody would like to, because this is an open forum discussion. So, anybody, Sandeep Ji, Jyoti, Zoom user, I don't know if you can please brief and please tell your name. So, anybody would like to add on to this questions, answers which doctor is giving, or should we continue? Okay. So, what are the non-traditional doctor approaches, holistic approaches you have seen effective in pain management? Like if you talk about the holistic
Oh,
approach, what would be
yes,
the thing?
yeah, yeah. The modern treatment is pain control means you give morphine, pethidine, Tylenol, Adderall. And there are so many classes of pain killing agent, anti-inflammatory medications, and diabetes and inflammatory type of disorders, non cancer disorders. But parallel to that, there are so many things that they were in my own practice and also in the observers' practice, which I have seen is other holistic approaches. For just simply, we are talking about physical pain control and also mental pain control. In the physical pain control, there are so many holistic approaches are available as we speak today, which include Reiki, acupuncture, massage therapy, and so on, and then all kinds of medication in Ayurveda field. Our ancient wisdom of Ayurveda, which is as old as Sanatana Dharma itself, according to some of my readings and observation. So there are so many approaches that are equally effective, and it can be given parallel to the modern type of medications also in advanced cases, at least initially, until the control is established. After that, you can remove and all the, as you see, with a follow-up and time, you can remove the expensive modern addicting type of medications, and some of the patients live very well with practically nothing or self discipline, and these holistic approaches which I mentioned. There are a lot more, and the homeopathy. Another experience. My first cousin was a Reiki master as well as a homeopathy doctor in Bangalore, and she used to give everything free of cost. Even though Reiki, they say if you don't give money, Reiki doesn't work. All those things I don't believe. It works, and everything healer is within you.
Mhm. So the willpower should be there within us to accept these changes and to,
Yes,
to take the new.
first, yeah. Go ahead.
So the willpower
Go ahead.
lies within us. The willpower lies within us in taking up these new approaches of modern therapy, modern, treatments which are available. But we are not doing that. Most of us are not doing that. We blindly go to the doctor, go to the physical, normal caregiver, and we ask them, okay, this is the problem which we have, and then they give us. But as you rightly pointed out, that there are so many options, like Reiki is there. Then do you think mindfulness meditation is also one of the good options which we need to practice in our daily life? When we talk about lifestyle changes and all, we always say, yes, we should bring in exercises, we should have good food, nutritious food we should have in our daily life. Then at the same time, we say that, having regular exercises and meditation. Nowadays, people are talking about meditation and yoga. So, how do you think meditation and yoga can really help with our pain and suffering?
See, if one person like me or anybody else in the modern age under stress, if he or she gets acute rage reaction because his or her boss pistima means made him angry, that action, and you are about to choke that other person, that type of anger it comes. What does onlooker elders tell you? Take a deep breath. Take a deep breath and take a deep breath for a moment, and then this that acute space of rage reaction calms down. They say, "Calm down, calm down, calm down." Some elders has to hold the hand. Sometimes they have to restrain the person, right? It's a normal. You don't have to be a rocket scientist to observe it in a day-to-day living of every person. Even dogs and cats, when they fight each other, the big dog will come and say, "Stop, guys, finish, stop, give it a break." Then everything becomes normal, isn't it? It's a starting point. Then, if the person continuously does and is disruptive, there are legal channels to control that person temporarily. Then, if he or she comes to sense that slowly with other people and holding hands, they will all contribute, and they talk about their life experience and how it went through. This group therapy, something like that. All these things are available. They don't have to be physically present in one place because of the modern technology and Zoom meetings like this. So that is the approach do, and when the patients with any type of a since being a medical oncologist, the patients used to come at the stage 4 level, and they are very afraid of the whole thing, and the fear of the unknown is a pain causing both mentally and physically. And then they have to start with calm down, and they want to answer even before complete analysis, physical analysis and testing. So then I had to do my own juggling and say that calm down, nothing is lost, take time, and slowly they will understand, and my popularity increases. Not that I am doing something bit different from other people, but the confidence between the caregiver and the sufferer person is a teamwork, regardless of the situation and type of pain he or she is suffering. That's all I can say.
So how would you, like, as you mentioned, patients come to you at the stage 4 level. So when we talk about, say, nowadays a lot of women are suffering from, as we are getting diagnosed with breast cancer, and most of the cases, which, as per my knowledge, they are diagnosed at the stage 4, because they're ignoring themselves, they're ignoring the symptoms. So how would you, brief about such symptoms, which, talking about, let's take an example of breast cancer now. Wherein would be the earliest symptoms which you think, which should be taken care of at an early stage? Where, or
Okay.
what
Again,
symptoms
that
would be there?
yes. Again, coming back, if you are to be specific with that breast cancer, any cancer that can show up as the medical science is well studied on that. They will say what to expect and how these cancers come and all understood. But in early stages of the most of the cancer, they are totally innocent and lying dormant in one place. Then they learn how to bypass that, and they keep spreading. And a lot of cancer, there is no pain at all. So pain itself is not a one of the, even though cancer in late stages, most of them will have pain. Early stages, there may be no warning or no pain, nothing. But modern technology has helping annual breast in specific to breast cancer. They recommend self breast examination and the family history. If there are other people are there, you have more risk for that. Those are all awareness has to be told to the patients. And then technical technology of mammogram and ultrasound things are there. Some people say mammogram is not good because they are expose them to radiation. Some people say we are not. but the ultrasound does not produce cancer. That is proved before, and the ultrasound is sound wave testing is much cheaper, like that. But if you do not educate people, how will they seek advice, which is available in your backyard? So that is specific to breast cancer, which also applies to other problems like inflammatory disease like lupus, arthritis, osteoarthritis, rheumatoid arthritis. They're all chronic pain. Ankylosing spondylosis is called inflammatory disorders are not related to cancer. Same thing. Early stages, if we caught, can be treated with the appropriate medication, a short duration with a long remission. But just going to self-diagnosis in this modern age for other people because of fear or anything cannot is not appropriate, and without people understanding that they will do that. So does it answer your question or anything
Thank
else?
you.
Yeah.
I have,
Hmm.
if anybody from our group would like to ask a question, like Jyoti, Geeta, if anything you would like to know more
Yeah,
about.
many people say, even so many people, right? We identified even cricket players and also healthy lifestyle, eating everything right. They getting cancer, even kids, babies born 2 months, 2 year, getting cancer. How do we define, we always say, oh, eat healthy and, have a good lifestyle. That causes, if you are that, don't causes a cancer, right? So even healthy people getting cancer, how do you define then how it is cancer? How do we know, like, detect early stage, right? Like total body scan will give, or what kind of scanning will, like, knows or detect that, it's gonna
Yeah.
cause cancer?
Okay, that's a very good question. The babies, in children below 5 to 7 years, there is a unique type of a group of cancers, and these are all related to some kind of a hereditary factor or something, but they are all curable. They are all curable. 90% is curable, and they are starting very good. One entrepreneur in Mumbai is starting launching a special clinics, free clinics for such people in India. He launched 6 clinics, and his goal is to do 20. But there is no screening. If the baby is behaving differently, or had a squint eyes, or had a big lump in the head is too big, or some tummy is swelling, immediately patient say, the parents, educated people should say that it is not constipation or something more going on, and they should go to the at least their primary doctor, and then proper referral by the doctor should, like a good doctor will refer that such a family to appropriate thing. And after finding the diagnosis, there are other screening tests to screen other babies or children born in that same family and catch it in early stage. Such technologies were already available. And also, there are blood tests here which can not only predict the a very small quantity of cancer, and also it tells you what type of cancer and where it is, even just simple blood test.
Okay,
Those are all.
what is the name of the blood test?
No, I don't know the name, but my buddy is in two places they are doing it. One in Tampa, Florida, and the other lady is in Iowa, University of Iowa, and she launched that product. And the third biggest cancer center in America called Moffitt, they are
Mm-hmm.
offering too. They are advertising, and I'm not keeping up to date because I'm retired 20 years ago.
Okay, so the blood test will identify the type of cancer, early
Not
stage.
only type of cancer,
Uh-huh.
earliest of the early stage, and what type, where is what type of the cancer, and what medications can be given specifically for
Uh-huh.
that in that early stage, and such kind of technology will cure it, and cancer can become history. But it does not apply to all cancer across the board. You have to
Mm-hmm.
remember that. Yeah,
Okay.
and this research is going on.
Okay, so there is a
So
there is a blood test available right now. That's what you're
And
saying?
and
Okay.
and do not to brag, all these innovators are Indians.
That's good to know. But then why it's not influenced to everybody? Like why it's not introduced?
Because there is a lot of legalities and
Mm,
money factor and personal glorification factor. I did it first. I did it first. Getting a patent approval, all these legalities there. 20 years ago, when I was working with the investigational cancer medications, the first one used for male cancer called testicular cancer.
mm-hmm.
And when I used it, it was 80% successful. Before that, they all died. But there was those days there was no red tapeism, no
Mm-hmm.
red tape. Easy to get the medicine. Give it. I used to even modify the dose a little bit, and I was not punished for that. But later on, my modification was much better tolerated by patients, and they were also cured. So that learning curve, everybody goes through that. So once
Mm-hmm.
that is done, you don't even have to see a doctor. Go to the shopping mall and put your $100 or ₹1,000 or something in the slot, and it will scan you, do everything, and next printout will come in the blood test, and it will tell
Mm-hmm.
you. With the holding the blood test, you can see they're all in the works. But
Yeah.
they're all in the works means it's not. They're all in the stages of various levels of research and development.
Mm-hmm.
But when that's what I'm saying. If anything of crisis happens in your family, you go to Google or Google Guru. I call him. I use the word Google Guru, and they will give you some ideas. Youngsters know everything about computers and everything. Instead of playing video games, they should pay attention to the family. And the holistic approach means the family starts with the nucleus of family,
Mm-hmm.
then the friends, then the surroundings. They're all one. And
Yeah.
with that approach, we can do a lot. We can't, this is not a solution, but there's one of the approaches.
Yeah, I know, understand, So we are aware of it. We are, eating right, sleeping, not to have a stress. But then getting kids involved, it's like very, very challenging for all the parents. Okay, even if we say eating fast food, if we say not good, but then, oh, they said it's so tasty, once in a while, can I have it? But, how do you tell them once in a while also have causes, right? So bringing awareness, this kind of habits to kids, it's really, really important because in America, everything is, many food kind is a fast food, right? So like, where we can control when they're home, but they're most of the time they're outside in a college or staying outside. So it's like, social media is like does not give that awareness, but the different kinds of awareness they have. Yeah, that's really challenging. Is I see, many kids. Not everybody get into healthy lifestyle, right? So.
Yes. And the reason is peer pressure. When they
Mm,
go out, they're on the open field, where they will copy the other kids doing it, and they say, if you don't do it, he's a marked person, and he or she, they laugh at them, make fun of him, things
yeah,
like that.
that's true. Yeah, that is true.
But when you are physically with your kid or the neighbor's kid, you have to make them aware this is not kid, and you be consistent, and you don't show that the behavior of which you are doing in your own lifestyle to start with.
Mm-hmm.
That happens without choice. Whether you like it or not, it happens. Then after three times, the kid says, my mother or father are doing it. Oh, who cares? What I do is my business. Even a young little brain works like that. So that's
Mm-hmm.
very important. But when the kid is around, that he or she is under control, you are the mother or father or uncle or aunt, they say, boy, Bubby, in a nice way, not in a rough way. You say, they will listen to you. It will get into their brain. Other day, I went to a birthday. Day before yesterday, I went to a birthday ceremony in a matta. Matta means a religious place, a Krishna matta or something, naming ceremony. And the dinner time, lunch time, we are supposed to have a dhoti and take the thing off, and they are supposed to have a sacred thread and everything. That's a custom for that matta. And the one child Small child was playing video game. Small 3-year-old child with a computer, laptop, little thing, and playing video game, and in any some video comics in a very loud way. The Matha people should say it's not allowed. It's nothing wrong saying that it's not allowed. Mother has to take the baby out, because type of a thing we don't encourage. We think if we don't do that, baby will cry. So baby is
Yeah, that,
already taken care of you.
yeah.
So this is just an example. Just 2 days ago, it happened in my own life in Chennai, where I am physically located right now, visiting my sister. So that is important for a when you are around. You say, "Boy, Bobby is not right," in a soft way, and be consistent. Then it will work. And then give them the basic values of sharing and unconditional living, unconditional giving, not living, unconditional giving from the very young age. I guarantee you, in my own life experience, it worked for my peers. Uh, Even though I was told to be a contrarian when I was growing up.
Mm-hmm.
So, doctor, I have a
So,
question here. I have a question
yeah,
when we're talking about this. Many of us get, either we get sad or we get hurt and, we get emotionally disturbed. It's very common in our
yes,
day-to-day life. Now, how does that affect our physical pain? And also I would like to know, the difference between the acute and the chronic pain. If you can just brief a little, give us a
yeah,
briefing.
yeah. Acute pain is like somebody stabs you, you can pain, right? And somebody pinches your ears and twists, you get the acute pain. And if it's acute pain in the tummy is different type, which is not only the somatic pain, it's a combination of somatic means nerves stimulated, and also spastic like pain is a different. Yeah, inside, like your gut gets very tight and you feel like choking. That type of pain. There's an acute problem where the various reason acute pancreas may get bust, gallbladder may bust. Then you get acute pain. Then when you have a diagnosis, we treat it and pain goes away and it becomes normal. And then if it's a gunshot wound, that wound, this wound, infection, they all can produce temporarily acute pain. Then when a doctor or somebody, caregiver, identify it, you give a diagnosis and appropriate treatment, they go away. But chronic pain is a irreversible damage to the nerve endings, which produces inflammation and pain, either in our joints or in the legs and all. Diabetes, we call it diabetes neuritis, and in the knee joints, we call it inflammatory arthritis. And stress, diet, and all those things can also contribute to cause it. And the proper person who identify it can give you a lot of diet modification and like anything in diet business, anything in the periphery of the department store is good. Periphery means outskirts, where they put cabbage, cauliflower, all those holistic non manure grown organic, so-called organic things. They're all good. Even egg, they say, I didn't prove it. The egg by a chicken organically fed only with vegetables, their egg has low cholesterol, and they have good cholesterol. And those scientific studies, and you cannot challenge and say it is true or it's just a marketing gimmick. I'm not there to analyze everything. Some of the things we see face value when you take it, and even if you say it's a dirty egg with a high cholesterol, you take it, but you believe it is organic, that also will help. See, that means you are initiating with the thought that is good for you, and the warning label says that you have to only take 1 or 2 organic, not 100 a day. So if you compliance and understanding. So that's how we go with the acute pain and chronic pain in a modern day. With again, acupressure, group therapy, all those things are there. And the people go into medicine and drugs are having some mental problems, which also gone beyond the drugs and beyond their capacity, and they become dope addicts, the chronic addicts. If you go off, if they cannot take the medicine, they have withdrawal symptoms and they get violently sick. Over that also, there is a temporary modern treatment for detoxification. After that, when they come to normal, you have to maintain yourself in the state. For that, you are the doer. If you don't have that motivation, you will go into the same cycle. And such patients I used to do once or twice or thrice. After that, I didn't say anything, kept my mouth shut, because it's not beyond my control. I felt that I finished my work and my duty. I still kept them as my patients, because when I keep them patient, I get some money. If they go, somebody else will abuse them and they get money. But to do the best, I used to do that. That was my approach those days. Now I don't have to do anything because I'm retired and I'm good time.
That's wonderful. So yeah, as we are coming to the conclusion of this podcast for
Yes,
today, I
yeah,
would like to summarize by saying that, just to have an understanding of what you just briefed, that,
yes,
having a holistic approach, looking, be having good healthy habits, as you rightly said,
yes,
smoking, drinking, it's all, getting rid of, all that. And main point is managing your time, having self love, taking time for yourself, doing journaling, brainstorming sessions, doing various, healing sessions for yourself is one of the best ways to come out of the pain and the suffering. So, and also the same time, having a good diet, speaking up your problems, consulting the doctor at the right time, getting yourself tested, or if you're near and dear ones, if you see that they're having these symptoms, getting it rectified, getting it, diagnosed at the right time is the right way. So, doctor, would you agree on this? Anything you would like to add on for the conclusion part of this podcast?
no, I 100% agree with you, but it does not happen in practical life. That's why awareness and spreading this type of telecast to the public who are interested, and what interests them is some kind of a pain and suffering in their self or in the immediate loved ones. Until then, they won't seek it. They will they do their own business. And there is no pain. Why do you want to think about God? Why do you want to think about a doctor? And if alcohol or drugs giving you pleasure forever, and then you will continue it until you suffer the consequences one day or other. Then only you realize, oh, I made a mistake. It may be too late, but it is not late. Whatever time you get in, if there is most of the things can be reversed and not cured, reversed, suppressed, or prolonged with a very decent holistic living for the rest of your God-given life. And every time it happens, so don't think of God only at that time. Every time, whatever you do, you make it a habit. Think about who am I and who is the doer. If you have that equation with you, and slowly do whatever you gain or lose, you laugh about it because you are not the doer. That's all I can say for this session.
Thank you so much, Dr. Rao, for your wisdom, and to our listeners for joining us. And everyone stay strong, stay mindful, and we will see you again in the next episode of our weekend podcast series by Enlightenment. So thank you so much, everyone, for joining, and thank you, Dr. Rao, for taking out your time. And we are looking out for such more exciting conversations with you in the near future as well. Thank you so much, everybody. Have a great day ahead. Thank you.
Okay. Good night.
Good night. Thank you so much, Doctor. Thank you, Girija Mataji, for joining in. And Zoom user, please share your name so that it's easy for us to address you. Thank you so much.
Thank you.
Thank you.
Good night.
Good night. Bye-bye.